that I need to get perfect.
Thank you. I had a reminder in my notes and in my phone, and yes, I still forgot. Thanks, Susan. All right, so the objectives for the training today will be to learn procedures for invoicing and reporting. We want to learn how to complete the monthly invoice and identify the purpose of the monthly reporting form. So after some brief introductions, I will have Susan go over the procedures, the procedure form, the summary, the invoicing, and then I will discuss the monthly reporting form. We're going to try to pause to see if anyone has any questions, and then we'll have a question and answer at the end. All right, so my name is Susie, and my role in all this will be that if any of you have gotten a chance to look at the reporting form, or the invoice, I'm sorry, there are some supplemental materials that will be due every month. It's very clearly stated what is due. And so my role in this will be not only to answer any questions that you have or any technical assistance that you might need, but to also monitor that portion, which is mostly for reporting purposes and does not really impact your payment. So that's my role. I will let Susan introduce herself, and then Madeline.
Hi, everybody. Many of you know that I wear multiple hats, and so I have been working with Center for Health Innovation, who is issuing all their contracts. And I'm also consulting with the New Mexico Alliance of Health Councils and working with Sharon and Susie and Madeline in developing their structures and systems as we launch this wonderful project over the next couple of years. And so, so today I will be reviewing the invoice, but as Susie said, she is the point of contact for questions, unless it has to do with your payment, but we'll get to that as we go through the session.
Thanks, Susan. Madeline.
Hi, everybody. My name is Madeline. I am the new executive assistant for the Alliance, and I will be kind of doing the collecting of monthly invoices and reporting forms and just making sure that those are all good and approving those and sending those to CHI to get everybody paid. So yes, so my email, I'll drop it in the chat here, but you'll be sending me your monthly invoices and reporting forms.
Thanks, Madeline. And yes, I forgot to mention one very important detail. I'm with the Alliance, and I too will be putting my email in the chat. Okay, so I'll go ahead and let Susan get started.
All right, so good morning. I'm going to be sharing my screen. We don't have a PowerPoint, but like I said, we do have specific documents to share, and these should be available to you on the shared drive in the link that Madeline sent this morning. And so what we wanted to do is start out in giving you the big overview in terms of the process. The main thing to remember is you cannot begin invoicing until you have a signed contract from Center for Health Innovation. So Center for Health Innovation's role is only to manage the contracts, but the Alliance will answer all the programmatic questions. So there are still, there's been 25 contracts signed. We got an update from Lucinda Tecca at Center for Health Innovation. And so there's still a handful of folks with unsigned contracts. So you cannot invoice unless you have a signed contract with CHI and also a W-9 on file. So if you do have a signed contract, your invoices are always due, your invoice for the month are always due on the 5th of the following month. And so let's use October for an example. Most reporting periods from November forward will always start on the 1st of the month and go through the last day of the month. The only exception is October, because your contracts don't start until October 18th. And so you'll see October, the beginning date will actually be the 18th through the 31st. If you have a signed contract, you will submit your first invoice on Friday, November 5th. The invoice amount will be a fixed rate. So everyone will get paid for the first state fiscal year. So your contracts all begin in October and will end June 30th of 2022. And then don't worry, because we'll send you a new invoice for year 2. So what we go through today is for the first 9 months of your contract. And that monthly, it's a standard monthly rate of $5,555.55 every month. So you don't have to worry about changing the invoice amount. So at the end of each month, Madeline will be sending out a reminder and a copy of the invoice. And I'll go through in detail the invoice in just a minute after we give you the overview, and then we could take any questions about the procedures. An important thing to remember is if the 5th falls on a weekend or holiday, it's going to be due the business day prior. That will be the case in December because December 5th falls on a Sunday. And so your invoice for the month of November will actually be due December 3rd, but Madeline will be reminding you. So if it's something other than the 5th, she'll be sure to let you know, hey, it's a little different this month because the 5th falls on a holiday or a weekend. This is important. If you miss your deadline on the 5th, you'll need to wait until the next month to submit your invoice and reports. So if for some reason you miss your October reporting period, which is due November 5th, you'll have to wait another month. You are allowed, if you miss a month, you can invoice for 2 months. Now, some of you don't have contracts, so you can't invoice for the month of October. So as soon as you get let's say you get your signed contract November 15th, then on December 3rd, because the 5th falls on a Sunday, you can invoice for the month of October and the month of November by December 3rd. Does that make sense to everyone? Okay, I don't hear any questions. So even though you're filling you submit your invoice by the 5th with the supporting documents, and those will go to Madeline, and Madeline will review and make sure that everything is complete. And every once in a while, we might skip something. We might put in the wrong report period, or maybe we didn't attach the monthly report, or maybe you forgot to sign your invoice. Madeline, for those of you who actually submitted your invoice with the backup documentation by the 5th, if there is an error or something is not complete, Madeline will get in touch with you right away. But you only have until the 10th in order to get in that cycle. So make sure that you respond to Madeline, or look for, if you see an email from Madeline on the 6th or the 7th, make sure you respond, because if you miss that opportunity, because she has to authorize those invoices for payment. And when she's authorizing that everything is received and complete. So if you're missing something, or if there's an error, she cannot authorize your invoice for payment. So we're really pushing this because in order for you're submitting all your invoices and backup materials by the 5th. And then there's a lot of things that happen in between, like the authorizations, and then it has to go to CHI, and CHI has to submit stuff to DOH and get paid. So the reason why your invoices are due by the 5th is so that you get paid by the end of the month. So as long as you get your invoices and the required reports in by the 5th, you should definitely get paid sometime between the 5th and the last day of the month.
Excuse me, Susan, you
yes.
said the 5th and the last day, but did you mean the 25th and the last?
Yes, I did. The 25th and the last day of the month. Thank you, Susie. And I'll go over the invoice in just a minute. And this invoice, like I said, is for October through June of 2022. And then in July, you'll get a new invoice for July 1st, 2022 through June 30th, 2023 for year 2 of the project. Year 2 amounts, and just something to keep in mind, year 1 is only 9 months. So we have your $50,000 split evenly across 9 months. So your year 1 payments are going to be a little higher than year 2, because year 2 payments, we have to take that 50,000 and divide it across 12 months rather than 9 months. And so also on this form, we have, if any questions about your invoicing or reporting, you can contact Susie. And then, but if it's a payment, if you don't receive your payment by the end of the month, please call CHI. So any questions so far?
Susan, Debbie Ortiz has her hand raised.
Yes, Debbie.
Hi, this is actually Stephanie. I'm stepping in for Debbie. She's on another meeting. I'm the office manager and I will do the payroll, that kind of stuff. Are we going to receive payment by a check, or will that be like a direct deposit? How does that work?
I believe they are by checks, and we will follow up with Center for Health Innovation and confirm that.
Great, thank you so much.
You're welcome. Yeah, in the past, contractors have, I know in the past CHI could not do direct deposits, so I'm assuming that everyone will be receiving checks.
Susan, did you mention that if for whatever reason they miss the first deadline and are not able to turn it in by the 5th, that the time for that would be 5 p.m., close of business, and also that if they happen to miss, they will be able to do more than one the following month?
Yeah, thanks, Susie. So it is close of business day by the 5th, 5 p.m. Mountain Time. And yes, if you missed that and you didn't get in that cycle, you can invoice for 2 months. And I did mention that earlier, and we'll show how that works. So I'm going to, because we want to leave enough time for questions and for Susie to go through the reporting. But hopefully the invoice format will look familiar to people. We tried to structure it as close as possible to what you're used to when you submit, when you get your invoices from your regular state funds. And of course, this is for the CDC project. So when you fill out your invoice, you want to be sure that you put your health council's fiscal agent name. We need to know who the check is going to, should be listed up here, and along with the address. And Madeline will make sure that that matches what Center for Health Innovation has on file. So this may be one of the things, if it doesn't match, she's going to return it to you because she cannot authorize it if it does not match what CHI has on file. The other thing that you'll want to look for that you will be filling in is the beginning and the end date for which you're reporting. So if this is for 1 month, so everyone who's reporting for October, the beginning date is the beginning date of your contract is 10/18/21 through 10/31/21. In November, it would be November 1st through November 30th. So you would just change what your reporting period is. If you don't yet have a contract and you then on December 3rd, you're going to be reporting for 2 months, you would put the beginning date, because everybody's contract dates start October 18th. It doesn't have the start date of the contract is always going to be the 18th. It may be signed later in the month, like October 30th or November 15th, but that's okay because it's retroactive to the 18th. So if you don't yet have a signed contract and you're reporting on 2 months, your report period would then be 10/18/2021 through 11/30/2021 if you're reporting for 2 months. Okay. So I'm going to, for purposes, pretend like it's just a 1 month reporting period. There are 3 columns. One is, this is cumulative costs at the end of the prior period. In other words, this is, what is your balance or how much, yeah, what is your balance at the end of the prior period? This first one is always, it's going to be 0 because you haven't reported. It's your very first reporting period. So leave this blank. Column C, Madeline will fill this in for you when she sends out the invoice every month. So it's a standard rate of $5,555.55. And then the balance, or column D, is what your remaining balance is going forward. And so, and then it just transitions over. So you should only have to worry about verifying column C. If for some reason you get it, because Madeline may not know if you're billing for 1 or 2 months. So column C will always be the same amount.
Susan, is 2 months the limit that Michelle's asking? Could you bill for more than 2 months, or is that the limit?
Only prior months. You can't bill in advance. So you cannot submit an invoice on November 5th for October and November because you haven't completed November. However, if you only want to bill quarterly, you can just hold off and just bill come January 5th, you can bill for 3 months if that's what your health council wants to do.
It would just throw the reporting off because we have that deliverable of 50% of health councils having health equity committees by December 6th. So if they're not billing until after that, would you want them to submit reports anyway, or just have the reporting be off?
And that's a really good point, Sharon. We really prefer that people bill monthly if they can. We do understand that there are going to be some issues with getting contracts signed. So we anticipate that there may be people who cannot invoice, but we're really hoping we have 100% of contracts signed by the end of November. If you don't have your contract signed by the end of November, if you could, well, Susie and Madeline will be monitoring that. So we may, for reporting purposes at the Alliance, we may ask that you go ahead and submit your reports anyway, because they have some reporting they have to do to DOH. But once again, if you could try to invoice, that would make it really easy for everyone to invoice and report on a monthly basis as soon as your contracts are signed. Okay. So what we did is for every month, we kind of gave you prompts in terms of the months that, or the type of reports you need to submit with your invoice. And so what we're looking for is, and Susie will go into this in more detail, but every month you have to submit a monthly report form, and Susie will talk about that in detail. There are some supplemental documents that are actually uploaded to that monthly report form, so she'll go over that. Quarterly, beginning in December, there may be a couple of additional reports. So anything that's indented is uploaded to the monthly report. But if you see anything like in December, there will be the monthly report with the supplemental reports that are uploaded. But then there is one additional report required by everyone, which is the completed capacity assessment form. And then there may be other reports that apply only to certain tiers. So if it says tier 2 only, it's only tier 2. And it says which tier you're assigned on your contracts. So, and if anybody has any questions about that, feel free to contact Susie. And if you're tier 3 only, you will also be submitting a quarterly report. So tier 2 and tier 3, you'll have quarterly reports that you submit, but you don't have to worry about submitting that until you submit for December, which is due in January. And then tier 1s, the only supplemental report that you have isn't due until June. The other things that Madeline will look for before she can authorize is the contractor has to sign and date. And the date it's prepared should not be prior to the end of the report period that you have up here. So if you date your invoice October 28th, Madeline is going to send that back because it shouldn't be prior to the end of your reporting period. So everything highlighted here are the things that Madeline is looking for. Make sure it's signed, dated, you have the correct invoicing, how many months you're invoicing for, and it would typically be 1 month, but it could be more than 1 month under unusual circumstances, and then your Health Council fiscal agent and address. So any questions before I turn it back to Susie?
Susan, I'm drawing a blank here. Did you want to go over you went over the procedures. Okay, so yes.
Yep, it's over to you on the monthly report.
Okay. Sharon, do you feel like we need to address any of the questions in the chat before I move on to the monthly?
Just a reminder that November 1st will be all about health equity committees. So don't get too worried about trying to get it all done right now. We want to make sure you know what the options are, and the options are what works for you. So you'll meet Everett and Natalie, who are working with health equity committees to support that work. So really, I wouldn't worry about that right now, but it's great that if you already have it in mind. And then Michelle just mentioned health councils that meet quarterly. They would have a hard time if the health council's trying to do this in only a quarterly meeting. It would be really tough. So they may want to consider having the health equity committee take the lead, or a subgroup of the health council, because it would be really, really hard. It's going to be moving pretty fast. So I think that was the main ones. And if I missed anything and anyone else needs more clarification, please speak up.
Thank you, Sharon. I also wanted to mention that what we were thinking is,
You saw Chris's hand, yeah?
oh, no, I can't. I don't know why I can't see that. Oh, okay, go ahead, Chris. I see it now.
Oh, no, I was just going to mention for those people that are having the quarterly ones, if you do have that subcommittee and they're like a core group, they could just do the monthly ones. And, you know, it'd be a shorter meeting minutes. And you could also have a shorter meeting of like 30 minutes. But as long as you meet that month and do a little report, then it should be fine. And then your quarterly report would be bigger if you need the money then. Because I'm thinking the same thing for our group, because we have volunteers that do our minutes. And sometimes they'll be like the month after that I get the minutes back, or, you know, a couple of months after that I get the minutes. But as long as I get them in a quarterly fashion, that's when we publish our minutes to the rest of our alliance. So some help or some guidance maybe just on the minutes deliverables would be a little helpful too as well, because we have core meetings every month, but we also have our full health equity alliance meeting as well too. So I'm just wondering about that deliverable, but I think
Yeah.
it's just jumping around it and making it work.
Yeah, and so to get, you know, your credit for your health equity committee being established, that's only the roster. It's the follow-up reporting that is minutes and progress and that sort of thing that Susie will tell you about. And Susie, Brenda's also asking when in the month would they get their invoices, because it could take several days to get it signed by the appropriate person. Are they getting that today, or when their contract comes? When does that happen?
Yeah, I was thinking about that too, because it actually would, because it's a Friday and the end of the month falls on a Sunday. Then although Madeline has already sent out an email to remind us of this meeting, today would be the day, if I'm not mistaken, that Madeline will send what she needs to send. And I saw a lot of questions about contracts. So I don't have Marisa's number on hand, but Susan, I don't know if you would like to put her contact information in the chat, perhaps?
Yep,
And
I
then
sure will.
has his hand up, Susie.
Okay. John, who was it?
Oh, it's
John?
me. It's me. Quick, well, point of clarification. So, I think the invoice templates, reporting templates, those documents, I'm understanding will be in the Google Drive that Madeline shared. Is that correct? So, I mean, health councils that are participating will have access to those templates at any time they want to complete this work. Is that correct?
Yes, it's a link. And once you have the link, you always have that link and you submit. Then the next month you use that same link and you will be able to submit for the following month.
Perfect. Thank you.
Does anybody else? I don't know why I don't get alerts about raised hands, but I don't see anyone else. I did want to comment that we had discussed perhaps doing like a refresher invoice reporting training for the first month, where you will be required to do more than the invoice and the monthly report. For those of you who have health equity committees, you will have already been doing your rosters and your meeting minutes, but it will be for the month of December, that will be the next unique time that you will be adding more things. So we are open to doing something like this again as like a refresher course. And also, because I forgot to mention it at the beginning verbally, please, for attendance purposes, and just because we want to know who's here, if you haven't done so already, include your name and the name of the health council that you represent in the chat. All right, so I'm going to share my screen, and just a little disclaimer here. I thought I would start with a PDF version of this Google form, just because I want to focus on the questions that are being asked. But just like we prefer that you invoice once a month and all that, we understand if you can't, but that's the preferred way. Our preference is that you fill out the Google form with the link. That will make Sharon's reporting so much easier. Everything on our end will be so much easier, because those responses go to an Excel sheet and it's a beautiful thing. So if you can, please, that's the preference. If you don't have internet or you have issues with internet, then a Word document will be provided for you upon request. So please email me and let me know if you need that. All right, so for now, let me share my screen and we can look over the PDF version, which again is just for training purposes. So it's not going to look like this. It looks a little weird, but all right. So Health Council's monthly report, CDC, health equity, and community rebuilding. So this item here is required. You will put in your email. If you put in the wrong email or the wrong format, it will stop you. So make sure that you put the correct format there. Okay, the next question is, you're going to select on Google Form which health council you represent. In those rare occurrences that you are filling out a Word document, you would just mark a box or a check, the little oval there or circle, whatever you like. Yay for all the health councils participating. Okay, just another reminder that if you don't have a contract yet, you won't be invoicing. But did we decide that if they don't, they're just waiting on a contract, can they still fill out this reporting form, Susan?
That's your call. I know we were encouraging everyone to try and fill out your forms on a monthly basis. Oh, because one thing we will need a separate report for each month. So if you're invoicing for multiple months, you will still need to submit a form for October, and then you start a new form and you'll submit a new report form for November. So we need separate monthly report forms for every month you're invoicing for.
Yes, that's such a good point. Thank you. Because we're gonna, so yes, you would be filling out the form, you would submit it for example, the month of October, and then you are welcome. So let's say you can't do it ahead, but let's say you're behind, and so you want to do November, then you would click the link again and start an entirely new form and marking the month of November, if that is what applies to you at that time. But yes, just to reiterate, one of these Google Forms for each month, please. I only did it up to June 2022, since this is the billing period for this portion here. Okay, so the next question is, please provide one major highlight or celebration your health council experienced this reporting period, big or small, we want to hear about it. So that's pretty self-explanatory there. In a minute, I will go through and do a sample submission.
Yeah,
So.
and if I know many of your health councils are involved in a lot of things, and we may need to modify this question, but we're really wanting a major highlight or celebration specific to the CDC project.
Oh, right. Yes, that's true. And with that in mind, the next question is, please tell us about a challenge or challenges you had this reporting period in regards to the CDC project. So, an example could be someone just mentioned that they had computer issues. Was that Evangeline? I can't remember. So that would be one. But if it's something more in depth, like, I can't wrap my head around the health equity, issue, which, by the way, there will be more training in November, but it's just an example. So that's what you would enter here. Next, we go to the staffing topic. Were any staff hired during the month reported? You would mark one of these. If it's yes, you will move on to the following questions. If it's no, you will skip to the question 10. So here, you would put in the number of staff hired. Again, Susan, I'm just gonna reiterate what you just said. This is all about the CDC project, right? So I don't know if there will be any events where someone would be hired for another issue, but what we want here, what we're trying to track, is for this project. Okay, here you would put the positions that you hired in the month that you're reporting, just in the month that you're reporting. So if you hired someone on November 3rd, you would save that for the November report. If you hired somebody in the month of October, you would put it in the first one. Okay, here you're going to provide their name, their complete name, their title, their email, and their phone number of all the individuals hired for the reporting month. Next, we go on to the section of health equity committees and trainings. Some will mark yes, some will mark no, and skip to the next question. If you mark yes, and we understand that not everyone is established with their health equity committee just yet, but again, more training in November to get you guys going. So if you mark yes, here is where you will submit your minutes and your roster. You are able in the Google form to submit both with no problem. If you have any problems, please contact me. And as for the roster, that's just a list of people that are in the committee, and you can leave it as is unless you have an additional committee member in the month that you're reporting, then please resubmit that with the changes. Okay, next, you'll be reporting on any strategies, progress, or outcomes of the Health Equity Committee for the reporting period that for whatever reason may not be reflected in the meeting minutes. Maybe they're all drawn up and they're ready to go, and you just, something new happened, or you just, maybe something fell through, or anything update, you can add it here. If you have nothing, enter not applicable, NA, otherwise you will not be able to move on to the next question. Most of these have an asterisk, so you will have to enter something. So if it doesn't apply, just put NA, please. Okay, the next question is, how does the work of the Health Equity Committee inform or affect the work of the Health Council? Again, more training of that in November, but really the point here is the function of the Health Equity Committee is to just ensure that the work that we're doing is equitable. And we just want to make sure that that is what's happening, that it's very intentional. So we want to put something along those lines in here. Next, we go to the section of training. Here, we want to enter the name of the training or trainings that your Health Council attended this period. So list those here in number 14 and enter the total number of participants that attended. So for example, let's say there were 2 trainings that you attended in the month of October, but only one person represented your Health Council. So instead of putting 2 in number 15, you would just put the 1, because that one person was the total number of participants that attended the training that you listed in 14. Hope that makes sense. Okay, so next we're moving on to the Health Council Capacity Improvement Plan. This is really the portion of what's coming up next. It will be for the month of December that you will be looking into this, so don't get too worked up about it now. You will have more training by CHI and Egan Hayes on this. So note this note here will be on the Google form by December of 2021. Each Health Council should have completed a capacity assessment. So that's what this is in reference to. You would just mark here. And then if you marked yes, you will be listing here based on your results. You'll be identifying your capacity improvement goal. And just as a reminder, these are the items, the supplemental items that I will be monitoring, and I'll be logging and looking them over and checking to see if, there's anything that someone might need support on. And I also plan on meeting with everyone just for 15 minutes, and you get your choice. You can choose email, phone call, text, Zoom, whatever you want, because if there's an issue, we just want to know about it. And so we just want to touch base with everyone to celebrate their victories and to make sure that there's nothing that's holding them back. Okay, so moving along, the next thing will be that you will upload your Health Council Capacity Improvement Plan. This is a template that you'll be given, and of course, once it's been developed. And if your plan has updates during the month reported, you'll upload the updated plan. And it will include a description of your progress and your accomplishments. So in the Google form, there will be a place to submit that. Next, we're moving on to the vaccine equity plan. Again, don't worry about this too much. This isn't going to happen until the spring of 2022, and you will receive training. However, when that time does come, you will answer the question, does your Health Council have a vaccine equity plan established? Yes or no? And then same thing, here is where you will submit your files. You will upload your vaccine equity plan. Again, if your plan has updates during the month, which we hope, there have been some progress, then you will upload the new description. And just as a reminder, again, I'm hoping for everyone to be able to use the Google form that we're going to look at next. However, for those of you who are going to be using a Word version, this is not it, but when you see it, you'll know that, of course, instead of uploading these into the Google form, you will just be sending them as attachments. All right, so this is the end of, that's the last question. So let me move on now to the actual link. Okay, hope everyone can see that. So I'm going to do, let me see if I can't make this a little bigger. All right, so I've entered in my email. Remember, if you don't do that correct, it's going to stop you and ask you to put in the right format. I will just pick the first one here as a sample. You're doing one of these for each month, so you can only pick one. I'm starting with October. Hopefully we'll just do 1 month at a time. Okay, so here we posted our job announcement. Yay. Could be bigger, it could be whatever, anything that you're happy about in regards to this project. Challenge, need help with health equity committee. Okay, of course, just making these up. All right, so if I mark here, you'll see that it will then ask me the questions about the amount of staff that I hired, etc. But if I mark no, it will move me along to the next question. So I'm going to go back to yes. And again, if you all need any help and you want me to walk along with you on this, let me know and we could do a Zoom together. So I'm just going to quickly put in these project manager. I'm just doing abbreviations for time. And then I'm just going to do, that's the name and number of my person. Okay, so then I move along here, the same thing. I won't do it every time, but if it's no, it will skip you to the next section. Here, just for the sake of an example, I'm going to add a file here. So this is where you would put in your Health Equity Committee meeting minutes and roster. So I've done just a little sample here. Here's my roster. I can add my second file. Your computer, of course, might look different. So there are my items. Okay, and here are the additional that weren't included in the meeting minutes. For example, if I had my PDF version and I didn't want to redo that whole thing, here's where I would add my extra strategies that I had. Okay, here's where you would answer this question. Same thing, pretty self-explanatory. You answer this question accordingly. And so here I'm going to put that I had 2 people that attended the trainings. You know what? Did I skip a question? Oh, I'm sorry. Yeah, this is the name of the trainings. So sorry. And here I'm putting in the amount of people that went. Now, I will say that this does save your answers until you submit. If you are moving along and you're like, okay, maybe you're a health council that had to do 2 of these at one time, and you realize that instead of doing November as opposed to October, and you're like, whoops, this is all wrong. So then you would go down here and you would push clear form, but remember, it's not just going to clear this answer, it's going to clear the entire form, and you will then start over. So just wanted to point that out. Okay, next you will, so for the first month, for example, you would mark no here and it would very quickly take you to the end. But for training purposes, we're going to mark yes. And you're going to put your goal in here based on your assessment. Again, you're going to add a file. Do you see how I was going to move along without adding a file, but it didn't let me? If you have marked yes to this question, you will need to put in your improvement plan. If you don't have what you need, then you will mark no. So I'm just going to do like another bogus attachment here so that I can move on. Okay, and again, you won't worry about this until the spring. As you can see, here's the message. It's kind of small. So for now, you would mark no, but for training purposes, same thing. Actually, I think you guys get the picture, so I am going to answer no on this one. Okay, and I'm finished. If you want a copy of your response, you would mark here so that it can send it to the email that you added at the beginning of the form. And when you are finished, you will enter submit. And if you were like, I put 2 people that went to the meeting, but I just remembered that 3 people went to our trainings. So then you would be able to edit your response here and resubmit. it saves everything. You would just go to the question that you wanted to fix and you would move along. So I'm just going to quickly go through all these. Okay, and so it is submitted. So once you're finished with this, you will close this window, completely close it. And then for your next month, if you're one of the health councils that needs to do more than one at one time, then you won't go into edit response. You close this all out, and then you will just click the link again that is given to you. Again, it's the same link. So for example, that's my edited version. So I would just go to this link that I have here saved, and boom, it takes me in and I'm ready to enter in my next month. Okay, so I will stop sharing. And again, cannot emphasize enough that I am here to help if you need any assistance with that. And I have not been monitoring the chat, so I think we're ready for our question and answers. We have about 9 minutes. I'm sorry this took so long.
So there was a question about using which email for the forums. Is the link, does the link work for anybody's email, or do they need Gmail?
Let me answer that real quick. Any email, the email that if you want your response to come to you, that's the email that you use. It would be nice to use the Health Council email, but it doesn't have to be Gmail. In fact, I prefer the Health Council email that is associated with your Health Council, because you can always just forward that to whatever other email that you need. And plus, if there's any questions about identifying who's who, the email will be an alert, but you do not need a Gmail for this form.
And then Enrique is asking if you're working on a related project with other funds, how would we report to avoid appearing as double dipping? And it's you're not getting paid according to the deliverables. They are a requirement. So if you report on something that's related to health equity and it applies to 2 different projects, it's okay, because we're looking at how when we talk about health equity in terms of vaccine equity in year 1, and then whatever community priority you have in year 2, we realize that you may have different funding sources that are supporting that work. The focus of this project is really about building Health Council capacity while we're addressing the issue of vaccine equity in year 1, and then expanding that with your other community health planning work in year 2. And it all relates back to the legislation, House Bill 137, and the capacity for community health planning that is required of health councils. This is giving you the opportunity to build some of those skills while we're looking at addressing vaccine equity and health equity in community rebuilding around whatever your community identifies as a project in year 2. Does the form allow for input of more than one email address?
I haven't tested that, but when I didn't put in my full email address, it wouldn't let me go. So I'm assuming if you put a comma and then another email address or even another email address, it's going to give you an error. However, you can put it to the email address that you control that is associated with the Health Council, and then you can forward it to whoever you need to.
I see health promotion team leader from Northwest is asking to be shared so that she can count some of this work towards the Department of Health DPO deliverables. And so that makes it easier for health councils. Other regions may want to do the same thing with their health promotion team leader. John Kutnak is raising his hand.
Yeah, I was going to say thank you to Michelle for that comment. So yeah, it's going to be extremely helpful. And I think that email idea to forward any reports to your health promotion team member assigned to your health council and keeping them in the loop as you're providing these reports, because we intentionally, I want to let this group know, we very intentionally worked extremely closely with CHI, with the Alliance of Health Councils, looking at the traditional DOH funding that you guys have always received. And we want to work with you to streamline that reporting and invoicing and make sure that we're not putting any undue burden on our health councils. We want to focus more on action and decrease administrative burden. That's my goal for the Southwest region. And I know as a health promotion management staff, we've talked a lot about that, is we want to focus
She knows that we're there.
building. So anyway, just wanted to throw that out there.
Thanks, John. And in the spirit of making less work, I also wanted to, I'll just reiterate what we talked at another internal meeting not long ago, that all the responses I've situated to where they will go to an Excel spreadsheet. So if you would, I can share those. That's what we're here for, right? We're all partners. So that might be easier actually for me to just share that document with the John and whatever other, instead of the health councils like, oh wait, who do I have to include? Oh, who do I have to forward this to?
No, I think that, yeah, however we can streamline it, it'll be awesome. I think the narrative though, so I'm an evaluation nerd. I think the qualitative piece, seeing kind of the comments and seeing some of the perspective on that form, very nicely done, I think will be really helpful as we're looking at kind of big picture and the more heads together on how we help build capacity and support our health councils is kind of where my whole brain's going.
So that's
John,
great that those comments actually show up in the spreadsheet form.
They're all in there.
Now, Chris is also asking, can health councils see the reports of their work quarterly or biannually altogether? Is that something you can share, like in a, like the spreadsheet with not seeing everybody's work, but seeing their own work?
Let me wrap my head around that. I'll figure it out. I think the answer is yes. I just need some time.
Yeah. Yeah, Sam would like to see that too. And I mean, if health councils are open to sharing all of that, if there's no personal health information that we're including or anything that would be need to be kept confidential, then maybe it is a document that could be shared. I guess it depends on what kind of information is shared there.
Yeah, and I love that comment. And as we are refining the overall evaluation system, we'll definitely take that under consideration.
Yeah, I was just thinking, just base numbers, thinking, we have trainings every month and everything. It'd be nice to see how trainings are going everywhere, or maybe just by region, so that way we can plan regionally better. For the Northwest region, that would really, really nice, especially for us that are mentoring other health councils. It would really be good to see how their reports are coming, or where we can help them improve in reporting, or where we can add in, maybe our own help as well too, because we want to be able to help along with that. And then also just in the statewide too as well, just by maybe on tiers. I know we'll get some numbers back after like a quarterly and after like 6 months, but that would be nice just to once we figure it all out.
And then you have a comment from Sam that she thinks it would be valuable to trigger more ideas for each other so health councils can learn from each other. We have a question from Jennifer about what is the deadline for turning in the W-9 to be able to invoice for October. I have a W-9 dated 9/27/21 from our new fiscal agent that I tried to turn in, but was asked for a different one. Not having any luck getting in touch with our fiscal agent today to get that filled out today. Susan, is that something you can address on behalf of CHI, or is that a CHI question?
It is a CHI question, but I will let you know that the W-9 and the signed contract do go hand in hand. So you can, we would like I said, we're hoping to have 100% of all contracts signed by the end of November. And so just be sure, in order for us to process, your contract isn't considered fully executed unless there is a W-9 accompanying it.
The signatures need to match. Is that what you're saying, Susan, on the W-9 and the contract?
I believe they should because the contracts are going to the fiscal agent, and then the W-9 is who who the checks are going to. So most likely they should match.
However,
don't worry
the
about-
signature, I'm
Okay.
sorry.
Go ahead,
I
Susan.
should say that we did come up with this thought that the signature on the invoice just needs to be from anyone in the Health Council that's authorized to do that sort of work.
Yeah. Yeah, and that's the invoice. So whoever signs the contract isn't necessarily the same person who signs the invoice, but the person signing the invoice has to be authorized to do so.
May I ask something? This is Susan with the Counseling Center. I do W-9s, and Jim Curlin with the Counseling Center is the one that signs contracts. So the two signatures definitely won't match. But we're the same company.
And that's
Okay.
what Jennifer's saying too.
All right.
And that's what, and Michelle is asking, can they use the same fiscal agent that they had for their DOH FY 22 DPOs? I don't see why that would be a problem. We just had a couple of health councils who have had to change fiscal agents because they couldn't handle contracts over 50,000.
Yeah, and the fiscal agent W-9, those are CHI questions. So once again, I will put the contact information in the emails for Marisa Teca, and we are asking that you also copy Lucinda Teca. I know it's confusing. They both have the same last name, but yeah, if you wouldn't mind also forwarding your W-9 or fiscal agent questions to Marisa and Lucinda, that would be wonderful.
Thank you, Susan. We are now 1 minute past. Wow, this is a lot. I think I feel good about it, but I know that there's still some confusion. So again, for Marisa and Lucinda, questions about the W-9, the signatures and all that, any help with the technical assistance, reach out to me, and Madeline will be sending out what you need today because today is the day. And we're really excited. So if there's nothing else, I think we're ready to go. Oh, well, it's too late, but I really do kind of want to grasp who wants to be contacted in what way. So I will be contacting all of you when this is all said and done, maybe the middle of November. So I will probably be reaching out to you to see, how do you want that? Something super quick and easy like a chat, or did you want a full conversation? So, all right. Thank you so much, everyone.
Great
Thank
job,
you.
Susie and Susan.
Bye.
Bye, everyone.
Bye. Enjoyed it.
Bye.
Very informative.
Thanks.
I can't get this to close.
You don't want to leave us.
And my little picture over here shrunk down. I can't enlarge it. And so I've got the back of my head and hands are over here.
I'm assuming that the chat is being
Oh, well.
saved and will be handed in with the recording. Will the recording and the chat be combined as a turnaround or
That's what I
turnaround
would-
resource?
That would be what I would expect. Is that what you're planning, Madeline, to send the chat and the?
I have saved the chat. So yes, we
Good.
can send it with the recording.
Okay, perfect, because I think that would be very helpful. Thank you.
Hey there, I had one more comment, and it's just on just what I was talking about all the reports coming in. We can also use those during legislative season to help give a better view of what health councils have done throughout the year. So as long as we compile as we go along, it will make that process whole much easier, and it also just make the graphing of those things and seeing those visuals a lot easier too. And I'm thinking the same thing on the smaller side of the health councils. Sometimes we have to do annual reports, and it really helps when we start building those little paragraphs each month. So I see this as a way of building, towards maybe bigger annual reports and making it easier on health councils that way.
Great idea. We
yeah.
want to use it as much as we can. So those are
That is
great
cool.
ideas.
Great meeting. I hope you were able to get a hold of our physical sponsor, Madeline, but hopefully she's usually available, but we just sent the information earlier this week too. So we'll get all ours sorted out too. And I'm not sure how we're going to be billing, but it'll be maybe for October, November, December, or we'll just start billing right away. I still need to figure that out with our core group and see we're going to go from there.
Okay.
But it was really great meeting. Thanks everyone.
Thanks,
Thanks,
Christopher.
Chris.